So my name is Ross Atkinson. I'm a programme manager with the Applied Research Collaboration Greater Manchester. I work with several different themes, one of them being digital health. I also work with organising care, and I support the capacity building team. So just as we start, I'd like to introduce two of my colleagues, Norina and Deborah, and I'd like to invite them both to say a little bit about themselves and how they've got to the point in their career that they're at now. So Norina, would you like to start?
Yes, thank you, Ross. So my name's Norina, and I'm currently a research associate in the NIHR Applied Research Collaboration for Greater Manchester's digital health theme. So previously, I finished my undergraduate and master's degrees in the University of Auckland in New Zealand, and I worked as a research assistant in my time there as well. So I worked for the Department of Psychological Medicine and for the Centre for Automation and Robotic Engineering Sciences. And I was just really excited about the prospect of doing research and really enjoyed my time. So I decided that doing a PhD would be the natural next step for pursuing an academic research-oriented career. So I was really eager to move to Europe for my PhD to be closer to my family. And I saw the ARC studentship advertised and was really excited to be involved in that. So I met with Professor Dawn Dowding, who was my primary supervisor, and she encouraged me to apply for the studentship. And then I was interviewed formally by all three of my supervisors and was really happy to get the studentship. And now I've finished my PhD and I'm staying on in the digital health theme as a research associate.
That's great. Thanks, Norina. So Deborah, would you like to introduce yourself?
Hi, I'm Deborah. I'm at the moment a senior clinical research nurse working for the emerging team in Manchester Royal Infirmary. My clinical background, yes, I'm a nurse. I've had different clinical experiences, and why I pursued research was, with my academic background, I've done my degree in nursing and I've done my master's in nursing, and as part of my master's degree, I've done my research thesis and I've published it in 2015. So after moving to the UK, I concentrated myself to get more of the clinical experience. And once I was happy with that, I wanted to pursue a career that is more with my specialty, that is critical care and research. So that's why I wanted this job. And when I joined this job, I wanted to equip myself with more academic research knowledge so that I will be able to excel as a research nurse in my specialty. So that's when this opportunity for the NIHR internship came up, and I wanted to apply, give it a try, and it kind of worked for me. So I had the privilege of working with um, my amazing supervisors, Norina, Helen, and John, and with their help and their motivation, I kind of completed a research, I would say systematic app review with my digital health and healthy aging theme, and we have successfully published it now. So looking forward to work with the same team maybe on more research projects so that I would equip myself academically to carry my role more efficiently.
That's brilliant. Thanks very much, Deborah. So can I just ask you a little bit more about that transition from your clinical role into becoming interested in research, and what attracted you to being involved in research initially?
So after my masters, after my masters, I was a junior lecturer. So I worked in a department called CNE and research, that's continuing nursing education research. So I was involved with the journal edition, sorting out different journal aspects, sending it for peer review. So I had the academic background of how to deal with scientific papers. So after moving here, I was in the clinical area. I was fully clinical, and when I was more confident with my clinical skills, I was thinking about what to do next. And research has always been there at the back of my mind, and I wanted to pursue a career which is satisfying me both clinically and academically. So this role was the right one. I wanted this, work for it, and after a few attempts, and I got it finally.
That's brilliant. That's great to hear. So have you now completed your internship with the Applied Research Collaboration Greater Manchester?
I've completed the internship with NIHR, so my next step would be to look for a pre-doc or a doctoral studentship. So I'm preparing myself on that. So maybe in future, if an opportunity comes, I would like to attempt for something like that.
Brilliant. And how has the internship gone for you?
I would say, as per papers, I was supposed to be relieved for say 250 hours, so it comes around roughly one day in a week. But I would say it was not enough. So I think I spent all that time trying to decide what I wanted to do. So my supervisors kind of helped me to brainstorm things, and I had all big ideas, but practically what can we do, what one aspect that you would like to concentrate on. So for me to arrive at this idea took a lot of time, so going through all the literatures behind what do we have, what more can I do. So it took a lot of time to arrive at the thing what I wanted to do. So I think I spent all my time on that, and once I was sure of what I wanted to do, then we worked on a action plan. We devised a protocol and all that. So I would say it was intense. Internship was definitely intense, and it was something that I wanted to do. So because I had my passion was towards it, and I was interested in doing things, and of course my supervisors were great motivators, and somehow all our enthusiasm matched, and the product came out well. So I'm here with my supervisor talking about it. Yeah.
That's brilliant. Well, it sounds like you're very enthusiastic and proactive as well, so that's brilliant. Thanks very much, Deborah. So I'm aware that you've undertaken some work together, Norina and Deborah, as part of your roles within ArcGM. Would you like to tell me, Norina, how you initially teamed up to do the work?
Yes, yeah. So I was asked to join Deborah's team as a co-supervisor, essentially. So my primary supervisor for my PhD was the same supervisor that Deborah had, and she asked me if I would like to join her and Helen Hawley-Haig from the healthy aging theme in helping support Deborah. And so, yeah, my role was essentially just acting as a co-supervisor. So I guided her from the start with the other two supervisors to coming up with the research question and the topic, and then all the way through to learning the research skills that she needed, and being able to publish her paper and going through the peer review process as well.
Maybe I would like to add more to what Norina said. So initially, it was all three of my supervisors trying to help me about what I wanted to do, not to help me to arrive at that particular aspect of the project. And I think after that it was Norina that I had to keep disturbing too often. So so for anything, if I have a doubt, I will ask her, and in no time she'll respond back with a proper good explanation of things. And anything I was comfortable to disturb her, and she was patient enough with me. So even with the app review that we did, one aspect of it, it's like I review all the apps, and she was my second reviewer. So the work was not like I did everything, so she has done the same amount of work, and we tried to compare each other's review, and then we arrived at a maybe a coefficient value, so correlation coefficient. So for all that, there is a lot of input from Norina's side as well. And then once we got everything sorted, so all this happened over just Teams, not in person. uh, so all this happened over Teams, and technology really helped. And you know uh, with SPSS, with Excel sheets, how to do the statistics, the Prisma chart, how to do a protocol, how to write a research article. So all that, for everything I had to keep disturbing. And once we kind of get a decent image, then we will disturb our senior supervisors. So Helen and Don will give their expert advice on that. So that made it look better. But I think groundwork as such, so I do something if I'm not satisfied, if I'm in doubt. So the next person to get in touch was Norina, and she was kind enough to help me. Also, I would say there were a lot of ups and downs. So, uh, you know, life gets in between, and there were a lot of ups and downs. And Norina was a great motivator, so she'll just ask like, how are we? Where are we up to? So that will kind of motivate me. Okay, fine, this one I'm doing it this week. So I used to come here to the office. Maybe over the weekends, get all the reviews done and concentrate, get the basic stuff done. And then once I send it off to her, then it's like, okay, fine, I've done my job. So it was great working with them, and technology has really helped us to get this work done on time, I would say.
That's great. Thank you, Deborah. So you've actually worked throughout the whole project remotely, and you've done all the work online. Do you think that's helped or hindered you to complete the project?
I would say that has really helped, because if it's going to be in-person meet, I don't think like, me being clinical, and if I request for 1 hour or so, my team was kind enough to support me on that. But if it was something like I'll have to go to the uni to meet my supervisor, that will take at least half a day. So clinically, I don't think I would have been supported this much, because technology made things easier. It was easy for, at least for me. Of course, working with that particular person in person is definitely useful, but for clinicians like us, we need to be clinical and also pursue our uh, academic passion. I think only Teams, the call, or anything that is technology based would help.
And I think as well, it was helpful in the sense that I could be available more as well. So if Deborah had any questions and needed to see any examples or run through anything, she could just send me an email and would quickly jump on a call, and I'd talk her through whatever she needed to know. So I think, yeah, definitely it helped. Although it was really nice meeting in person. So we met in person for the first time last week, and it was just really lovely just having that.
Yeah,
You have more of the sort of informal side of, yeah. It was really
maybe
lovely.
it would have been nice if I was in person working only on this project and concentrating only on that. Then being in person would definitely help. But it's only part of my uh, research role, so it was for my passion that I wanted to do. So not compromising my clinical aspect. And if I want to pursue something extra, I think technology and remote concepts like this would make things easier.
That's brilliant. Thank you very much. So you've spoken a little bit about how you've done the work. Would you be able to talk about the work, the project specifically, in a little bit more detail? What are the key messages of the work itself?
Okay, so my project was on menopause apps. So basically, we reviewed menopause apps with special emphasis on osteoporosis. So apps as such as it comes under digital health, and menopause is part of women and their healthy aging. So this was something that would fit in mm, both my themes, I would say. So what we actually did was we looked at all the menopause apps that are available in the app market. So we looked at apps in Apple Store and Google Play Store. So there were a number of apps, and we had some inclusion exclusion criteria, and based on apps that qualified in the inclusion criteria were taken for the review. So around 28 apps were reviewed. So we use different scales to measure the quality of the apps, the of the apps, and how easy they are, how informative they are. So looked into all small details of the app about how useful they are. Basically, are they really worth used by the by the community. So what we found was, so we used the Prisma chart to narrow down our apps that qualify the inclusion exclusion criteria, and we used Mars, which is a scale to uh, measure the functionality of the apps, and and we measured about and what we found was about say 57% of the apps uh, had content of osteoporosis, whereas a large percentage didn't have the enough amount of knowledge that the women would like to have. So what we found in the literature review was it's not just the um, tech person designing the apps, but it should also include the users. That's in this case the women who are going to use the apps, how friendly they are going to be, the content in the app, and maybe the health professionals that need to be involved in that, and any notifications, any personalizations that would help women to uh, undergo menopause in a right way, and what preventive measures they can do to um, avoid or deal with osteoporosis. So, as we know, we are moving towards technology-based future, and most all of us are using apps. And this menopause is going to be an unavoidable stage in a woman's life. And if we have apps like this, it'll be better if they have been clinically trialed, so those apps could be more reliable and more uh, of more better value than any normal apps that are available in the market. So this would be just a gist of what we did in our app review.
That's great. Thank you very much, Deborah. That's really comprehensive. So I wondered, what have you learned from working together on this project?
Yes. So,
That's fine.
first of all, it was a great privilege to work with this team, and this concept of digital health as such is a new thing for me. I have dealt with different other aspects of medical care, patient care, maybe even healthy aging and all that, but this aspect of digital health was a brand new thing, and I am I like technology. I'm usually a techie, and anything uh, of any new gadgets or any new apps I would like to try. And this concept of technology, if it's gonna come in my career, on in the medical field, I wanted to try that. So in this, when I worked with the digital health. Uh, uh, Team, there was well, I've heard about systematic review, meta-analysis, and all that, but the concept of systematic app review was really new, and the Prisma guidelines and all that was really new for me. And uh, it kind of helped me refresh how to approach a research project. So I know I'm a research nurse, but this kind of this doing this internship kind of prepared me to become a nurse researcher. So how to take up my own project, what are the different steps involved, and what is feasible, what is not feasible, and how to go about literature review, how to do the statistics aspect of things. So those, and how to um, look at the scientific base behind it. So it kind of helped me brush through all these, and of course the the art of reviewing the apps, all these were new skills that I learned from this project.
And I think the main things that I learnt is just how rewarding it is being a supervisor, really. It was great to see Deborah develop all these new skills and just become more independent as a researcher. And I think just being able to have that publishable output at the end was just absolutely fantastic. That wasn't something that I expected. So I was very happy about that. And the other thing that I learned as well is that when you're teaching somebody new skills, it really cements the knowledge that you have. So Deborah was asking really great questions that sometimes I wouldn't have considered, and so she was challenging me and sort of questioning what I knew as well. So that was really nice. It led to some really nice debates and critical thinking about the methods that we use.
That's great. Thank you. Thanks to you both. So it sounds like it's really been beneficial for you both, and it sounds like you've been quite a supportive supervisor, and you've had a really proactive student, Norina. So that's brilliant. So I wondered if you could just tell me a little bit about your affiliation with ArcGM and how you think being associated with ArcGM has helped you to work together on this.
I would say if I didn't have this opportunity, so this was only through RGM. If I didn't have this kind of opportunity, I don't think it would have been feasible for me to have a taste of what academic research would have been in this country. ArcGM has given us, the clinical members, an opportunity to see how academic research would look like. I know people are kind of hesitant when they are told about research. They think it's too academic or it's not my cup of tea and all that. But if you really want to do it, how to go about it, how to approach it. So we were kind of blind, and I didn't know how to get in the uni with doing this role as a research nurse. So this opportunity was a great this was a great thing for me, at least. So uh, I had the, what do you say, um, chance to try something academic. So that was possible only because NIHR ARC thought of something like this.
And Norina, for you, how has being associated with ArcGM been beneficial for you?
Yeah, so I think being affiliated with the ARC has just enabled for really nice collaboration with researchers that you might not generally be working with. So Dawn and I were both based in the digital health theme. Our co-supervisor, Helen, is based in healthy aging. And then we also had some support by the capacity building theme as well. So there were these monthly meetings where all the supervisors came together and they would talk about their experiences. And so for someone going into supervision for the first time, it was just really nice to get that support from other people. And I think for Deborah as well, she benefited from being part of the capacity building theme in terms of her ability or opportunity to be able to present her work at the annual capacity building showcase as well, and have the opportunity to be questioned about her work and sort of defend it and respond to those questions.
That's brilliant. Thank you very much. Well, it's been a real pleasure working with both of you up until now. But I just wanted to ask, what is next for both of you?
So I am preparing myself to attempt for a PhD when the opportunity comes. So any PhD studentships or PhD through maybe publication, if I get to work with Norina on more projects. So all that I can do to prepare myself to take up a PhD studentship in future. So one day I will want to become one day I'll want to be a Dr. Deborah, so I'm working on that.
It's brilliant.
And for me, so I'm working as a research associate now, and I'm just looking forward to many more collaborations with Deborah and also potentially supervising a PhD student one day.
So I just wondered if you think there are any other considerations that people applying to our opportunities may need to consider.
Maybe I'm a research nurse, so access to computer is very easy for me. So my job is mostly to do with computers and my data and all that. So I have access to computer. But if it's going to be a clinical nurse, like somebody who's going to be clinical most of the time, I'm not sure how easy it would be for them to have these sessions when and where they want. So that's something to be looked into. So I would say that. And maybe for to pursue something like a PhD studentship or something. So it's easier when when we finish our degree, masters, and PhD. So the funding kind of covers that. But for clinicians like us, if say NIHR or any other research base, like even for RRNI, if they want a clinician to have an academic background like a PhD studentship, PhD degree, I think we'll have to again look into our funding to get it more better. So we are motivated and we are supported with opportunities and funding. So many of us, so many of us, will be motivated to pursue a degree like that. So that will enhance the quality of the staff that we have. Also, with regard to healthcare research, if a clinical person is involved, I think their contribution to research would also be enhanced. So it's something that can be thought about.
That's brilliant. Thank you very much. So I just wanted to ask you one last question. I just wondered if you would recommend the ArcGM internships to other people.
Yes, of course. I've already recommended and I've been preparing some of my colleagues to attempt the internship. So there were three, four of my fellow research nurses that wanted to apply for internship, and some of nurses from the intensive care unit. I've told them about doing this internship and the benefits of having this chance of having done this master's module in research. So all those things kind of fancied them, and they are really motivated once they get approval from their manager, and once they get support from their clinical field. There are quite a few of them that are motivated to do this internship. So yes, of course, yeah. And I
Brilliant, thank
also mentioned this in the Band 6 development course for the critical care nurses upstairs. So when I go to take this session, I mention this and they come back asking for more details, or I refer them with the website. And, if they have any queries, they try to get in touch.
Brilliant. Thank you, Deborah. And Norina, could I just ask you as well, would you recommend to others working in the applied research collaboration to offer up their services as being a supervisor?
Yes, absolutely. And I've talked to a lot of my PhD colleagues about it as well. I just think it's a really nice first attempt at being a supervisor. So you're not supervising a full-time student, but you're getting to learn the supervisory skills of other experienced supervisors, and you're working with people who you might not have worked with otherwise. So yeah, I was able to meet Deborah and learn about her clinical experience as well.
That's brilliant. Thank you very much.